Okay, so we're going to be talking about the urinary system. As you can see, not easily seen because it's very far back in the body, very posterior. If you remember, the body is divided into two main cavities, the dorsal cavity, which contains the brain and the spinal cord, and the ventral cavity. The ventral cavity we can then divide into two spots, the thoracic cavity and the abdominal pelvic cavity. And so you need to kind of remove some organs to be able to see the urinary system. So if we get rid of the lungs, still can't see it, of course, because they're not part of the thoracic cavity, because the thoracic cavity is separated from the abdominal pelvic cavity by the diaphragm. We take out the liver and the stomach. You can start to see a kidney here. And you can see the spleen over here, but you can't see the other kidneys because the kidneys lie in the retroperitoneal space, actually in two fatty pockets in the retroperitoneal space. So here, finally, are my two kidneys. Okay, and yeah, they are actually one is a little higher than the other in the body, based on structures and other things that kind of get in the way. They're attached to the inferior vena cava and the ascending aorta. And so then when you look at them, they are also attached to two ureters that then go down to the urinary bladder. And the urinary bladder actually sits in the very bottom of the pelvis. So if you remember, the abdominal pelvic is divided into the abdominal region, stops right here at the hips, and then the pelvic region. So this bladder is sitting in the pelvic region, and then what you can't see is the urethra that goes through the muscle wall and connects to the exterior so you can void your urine. So it's actually a pretty simple system: the kidneys, the ureters, and the urinary bladder, and the urethra.